Wir haben noch einen Vortrag vor der Pause von Herrn Dr. Jorge Cancela, ein Kollege, der sich mit den sinnvollen Applikationen von Software, und die Betonung liegt auf sinnvoll, für Patienten beschäftigt. Und ansonsten freue ich mich sehr, Jorge, auf deinen Vortrag. Herzlichen Dank. Thank you for
the introduction. And sorry, yeah, it's in English and with the slides, so I'm coming back to the basics. And I will try to focus on my talk now because you give us like so much stuff to think about that now it's going to be, there are a lot of ideas in my mind, like, okay, a lot of things to digest. So I will try to focus. But yeah, thank you for the introduction. I'm Jorge Cancela. As you said, like my background is like I'm engineer by training. Then I did my PhD in biomedical engineering, and now in the last years I joined Roche. I'm working with the digital health team, especially in neuroscience. And basically, we are trying to figure out how to move these concepts and these ideas into real products into the market. So I think that in my talk I will step back a little bit to the today. I will try to talk like what are the challenges that we are facing today. And some of the things that I will be sharing are really based on our own experience trying to go through this process. But before I start, I would like to thank you, the host and the organization of this event, because it's always very hard to organize these things, but I cannot imagine how hard it was this time with this hybrid setup and translation in real time, and it's fantastic, so thank you very much. Yeah, so I think that, I'm not going to surprise you here, like we're talking about this, but I think that the adoption of the smartphones is really high today. We are very attached to these devices, and for good or for bad, we spend our days with them. And from the time that we wake up until we go to bed, and some people even, they take them to bed. Strange, but it can happen. We spend the days with these devices, right? And there is another interesting aspect with them, which is like the growing number of sensors and capabilities that these devices include, right? And especially, it's not so much like the number of devices. It's interesting to think about like the quality of these sensors and how this has been evolving in the last decades. Because when we will talk about data quality later, right? But this is one fundamental consideration when we think about these kind of solutions and digital solutions, is that at the end they are not running on a clinical grade hardware, right? They're running on consumer electronic devices. So there is a first consideration there around like the data quality. But this quality has been increasing in the last year. So it's like the number, but also like the quality, the thing that is quite interesting. And at the end, as it was said like earlier today, like the interesting thing is that first we can gather all this information, and this can help us to better understand in a more continuous and granular way how we function as human beings, to capture different domains of those different domain functions that could be relevant to characterize how a human being function and how that is impacted in different conditions and diseases. And then as a second step, to deliver like interventions through this channel. And not only that, but to try to prevent and predict what's going to happen. And this is just like something that we will keep coming, right? Like now we have like the smartphones, but now we have all these wearable devices that follow a similar logic and evolution in the terms of the quality of the sensors and the capabilities that they include, right? And this is something that is coming from smartwatches, smart bands, lens, insoles, rings, you name it, right? So first, I would like to start with some opportunities before we jump into the challenges and the hard part. And again, probably I'm not surprising you here, but I think it's nice to see that here we are not talking about the future. We are talking about things that are already here, right? And especially like in the last, for example, this is a number of digital therapeutics that are already approved, right? So that they have gathered enough evidence to prove their effectiveness, that they have gone through the regulatory approval in Europe, in the US. Most of the examples are coming from there. And at the end, we're talking about digital interventions that are, or software solutions that are intended to treat, prevent, or manage specific conditions, right? And as you can see, like, we cover already different therapeutic areas in different diseases. And again, this is not about the future, it's something that is already here. And it's not something that is like, these examples are probably, most of them are, again, coming from the last 3 to 5 years. So it's quite recent advance, but it shows the level of maturity that we have today. A second example that we saw in the last 18 months was like the increased access to health through telehealth solutions and telemedicine, which was particularly important during this period where, you know, we had all the lockdowns. We tried to keep the patients at home as much as possible in some cases. And this kind of technology and platform showed that it was ready to go, that it was effective and ready to go. Of course, probably we will see this now coming down again, right? Because at the end, the face-to-face interaction, especially in some conditions, is something that we do not want to replace. But at least we know that this technology is ready and is available there if we need that. And in some cases, even now, even if the patients can still come back to the hospital, it could be interesting to think in which cases we can use this to complement the existing care that is delivered today. A third example of opportunities or things that are happening that I think that are quite interesting is that some countries are already taking this like a step further. And this is, for example, the case of Germany with the DIGA, that they already have created like a specific path for the reimbursement of these solutions. Again, all this needs to go through a process of understanding not only like the quality that is behind the solutions and the evidence that is behind the solutions, but also like what's the value for the healthcare systems. But again, it's another step that shows that today there are already some level of maturity of the digital solutions in the healthcare space. And so far, I was only mentioning examples that were related to the patient care or the clinical care or the clinical practice. But this is also impacting or can potentially impact the way that we do research and we learn, right? And this infographic is coming from the Digitale Medicine Society, which has, apart from this fantastic infographic that you can take and take a look in their website, they have a database that is public with all the existing clinical studies that use today a digital endpoint. As you can see, they expand across phase 1, phase 2, phase 3 studies, where you can find today studies that already include a primary, secondary, or exploratory digital endpoint, either in drugs or devices. So again, this is not about something that is going to happen, it's something that is happening today. And as you can see, it's not an insignificant number of studies or an insignificant number of digital endpoints that are already available today. And of course, the opportunity here is that we can have, as we said, right, like we have a smartphone, we spend the day with a smartphone, so the opportunity to gather information at much more granular level that give us a completely different picture of how a specific human being is functioning is quite interesting here. So if we summarize like the opportunity space, and I think that, you know, probably most of the audience is quite familiar with that, expands from, you know, potentially improving like the way that we deliver care and the clinical practice, but also like the way that we do research and that we learn and that we advance the knowledge about the specific conditions or diseases. But of course, this comes also with their own challenges, right? We can start, for example, by thinking like how all this fits into the real life, how all this fits into the clinical practice, right? Because at the end, we are talking about a new device, a new thing that you need to do. So it's an extra thing that we need to add to the things that you normally need to do. So it's like, at the end, it's creating like an extra step and extra work. Most of these solutions are isolated. So how do we integrate this with the rest of the clinical flow? How do we understand which of all these solutions, of all the offering that is available, which ones meet the right standards of quality or safety or evidence? How we are able to do that? How do we understand? How do they meet like the requirements regarding safety, effectiveness? And of course, like considerations around like data protection, data security, ethical issues, and of course, like how all this comes together. As I said, like if we are talking about consumer electronic devices, how do we ensure like that those have enough data quality to meet our needs? So all this, as I said, like is part of is something that we are living in firsthand, or I'm living in firsthand. In the last 3 years, we have been going in this transition of this specific program that is Floodlight MS, which is intended to measure different functional domains in people living with MS, into something that was like a concept, into something that we can really launch in real life, right? And now specifically like the challenges part, I'm very close to them. And to talk about them, I would like to draw like this parallel with the car industry, even if it's a bit weird. But I think that, at least for me, it helps me to understand some of the considerations and how to think about them. I think that today we all consider, or we think, that driving a car is probably safer, more reliable, and more convenient than, I don't know, 20 or 30 years ago, right? I think that the interesting thing of this is that this is not the consequence of only the car manufacturers building better cars. It's a consequence of a number of different things that have been improving in the last decades, right? So if we think on the first aspect, it's probably like, yes, it's the car itself, right? Like car manufacturers now probably build better cars in the sense that they are probably safer, more reliable, more convenient, right? And this is something that has been changing. And in part because they want to build better cars, but also because like what we expect and what we include in the regulations that shape those cars are the things that we thought that were important, that probably were like safety, reliability, and convenience. This framework can, of course, change, and it's changing now, right? Like now, for example, we give much more importance to the footprint impact, right? That's something that we also want to consider, something that we also want like the car manufacturers to consider when they build a car. So I think that this is like the first aspect is like, these things has been evolving thanks to the regulatory frameworks, but also we need to understand how to frame those regulatory frameworks. Are we framing them in the right way? And I think there are like many ethical considerations to think about. And of course, like this only covers one aspect of that, right? Like you can build a compliant car, but maybe it's not the car that you need. Maybe you need, they build for you a small car and you have a large family, you want a large car, right? So there is a second consideration that even if it's compliant, there is something else there that we need to understand how to meet those needs. The second aspect is the common infrastructure. Like the very interesting thing about the car is that you can take a car here in Basel and you can drive to my hometown in Spain, right? And there is probably a network of roads that are interconnected and that add value to your driving experience because you are able to go from here to there, right? And this is not like because someone decide like, Jorge will be living in Basel, we need to build a road from Basel to Spain. It's because there has been this evolution on the infrastructure and the interconnection of that infrastructure, right? And is this interconnection the piece that adds value? And also like the capacity of that infrastructure to attract and to establish other services that add value to you, like for example, a gas station. At the end, like the autonomy of your car is as good as the gas stations that you can find in your way. If not, you will be limited to there, right? And the third aspect, is like this, think about the training that we need. Like to drive a car, we need some specific training. We need to get ready to do that. But also we need to adhere to a specific code of conduct, right? We cannot drink if we want to drive, and we need to respect like the signals, right? Or if we cannot do that, we can use the public transport. So there is a number of services on top of that. So what does it mean for digital health? On the first aspect, like when we think about the manufacturer of these solutions, I think that this is something that is maybe not so established, but actually to build digital solutions, there is also like a specific regulations today, at least on the main markets, to build the solution. Like it's called the software as a medical device that provides clear guidance on how to build these things, right? So, and of course this is good because this provides like some confidence. Like in the same, if we go back to the example of the car, you don't need to be an expert in car safety or engines to buy a car, because you know that there are some minimum standards that they will need to adhere to be able to commercialize that car that give you like that confidence, right? In the same way, these regulatory frameworks can do the same for digital solutions. But then, of course, are these regulatory frameworks fit for purpose for the solutions that we need to deliver today and for the technologies that are coming, like artificial intelligence? Probably not. And then the technology is normally much faster than the regulation about the technology. So unless we have like a clear, basic, established ethical framework that can help us to advance at the same pace, it's going to be always behind. And then the second piece is that, again, we can have a fantastic compliant digital solution, but maybe it's useless. Because compliance is one thing. It needs to prove that you adhere to some specific quality standards. But again, what's the value that solution delivers? That's a different question. And it's a question that probably today is not so clear, right? Like the compliance standards are more clear, but the value standards or how to assess the value of these digital solutions is not so standardized. There is this European project called mHealth Hub that is doing a very good job trying to map all the different initiatives across Europe that are established at the moment to try to assess this value. And it's quite interesting, but it also shows that there is not a clear agreement and path to move forward there. The second one is about the common infrastructure and what does it mean for digital health. So if we think, I think that we can all agree that these digital solutions in isolation, the value that you can get is very limited. Unless you have a solution that is able to do everything, which I think is going to be impossible, because everything will also be different from one person to the other, right? So then the thing that we can do is try to think how we can connect these solutions. And again, here I think that there are also like very interesting aspects and considerations from the ethical point of view. Is one of the reasons why, especially when we talk about digital solutions in healthcare, which I think that we all have the sense that it's a very fragmented space, so solutions are very isolated. And most of the time this is done on purpose, right? Because we say like data security requires isolation. But at the end, like we are losing opportunities there. Like what will be the value of taking all that data to understand health at population level, right? And what we can do with that, for example, in situations like the ones that we have now with the COVID. So I think that there are like an opportunity there to think on how to deal with that. And this is like one of initiative from the Finnish Ministry of Health, thinking on how to enable this secondary use of health data. And one part is about laws and regulations and how to establish that framework, but they also like went a step further there, try to establish a way to actually enable these initiatives, literally, not just by creating the right framework. And my final comment, which is again about the training. So how do we need to evolve our skills to understand and to be able to deal with this new reality in the proper way, right? And this could be like, of course, like, for example, how to evolve like medical education to be able to understand and to deal with software as a medical device and to be able to deal and understand data privacy aspects. But there is also like an aspect of how the teams need to change and evolve, probably in a we were talking about the fragmentation of the IT systems, but that fragmentation sometimes is not only the software, it's also like the teams that work together, right? And try to build these teams that are more multidisciplinary. And I think an example is myself. I'm engineer by training, and now I'm working on medical affairs in a pharma company. So, which is something that when I was like doing my engineering degree, I didn't expect, to be honest. But I think that it shows that there is a new reality that requires like different people working together. And I can tell you that from that experience, even the terminology that we use when referred to things like studies or data is so different that the sooner that we start coming together and working together, the sooner that we will start probably delivering better outcomes together. And this was it from my side. Thank you very much again for your time.